Hi everyone, this is Dr. Corolla Okogbaa with Louisiana Center for Eyes. I just want to come on today and kind of talk to you guys about diabetic eye disease. November is actually Diabetic Eye Disease Awareness Month, and many of us know someone in our family, our friends, colleagues who have diabetes, and what I like to do is kind of go through and kind of talk a little bit about how does diabetes impact the eyes. Okay. And so, in honor of this month and for awareness sake and to educate folks about how diabetes can impact their vision, I'm going to be answering some questions that my patients ask, and also just kind of let you all know a little bit about the connection between diabetes and your vision. And so, what I like to do today, just talk about who who's at risk for developing diabetic eye disease and what exactly is diabetic eye disease. Okay, so let's talk about what is diabetic eye disease. So when you have diabetes, as you know, it's the blood vessels in your body that gets affected because there's too much sugar in your bloodstream, higher than normal. So over time, that leads to weakening of the blood vessels, damage the blood vessels. And one of the areas that have a lot of tiny blood vessels is definitely our eyes, right? And so over time, with diabetes, these blood vessels get weakened and you can develop what we call diabetic retinopathy. You can develop new blood vessels in the eye. You can have dot hemorrhages. We can develop what we call macular edema, where you have swelling due to protein leakage out of those weakened vessels, and all of that can lead to poor vision and blindness. And so those are some of the things that diabetes do. And obviously also if diabetes also increases other things that can happen to the eyes, such as increase your risk of developing glaucoma, cataracts, all of that. Okay, so diabetes is actually the leading cause of new cases of blindness in the US in adults. Okay, also, the older we are, the more at risk the older you are, the more at risk for developing eye disease with diabetes. The longer you've had diabetes, the longer also your risk increases. If you're African American or Latino, your risk of developing poor vision and diabetic eye disease is also increased. And so these are the individuals that are definitely more at risk for developing diabetic eye disease. And so I just want to kind of talk about that and what can you do to prevent or slow down diabetic eye disease is really to make sure you get your annual eye examination. And so for most people, it is a once a year eye exam. Others, it is more than once a year, depending on what's going on with your eyes and how well your diabetes is controlled. Okay, and so you don't want to put it off. For example, I have a patient came to see me recently, actually had diabetes for over 40 years, but guess what? Had never seen an eye doctor. And she's been having poor vision over the past 6 months and seeing little things floating in her eyesight. And lo and behold, she's got diabetic retinopathy. She's developed increased cataracts, all those things that we really don't want to see. And so, yes, diabetes can impact your eyes, but you have power over that by taking care of your diabetes and making sure you get your eyes examined, because we want to keep the eyesight healthy, and we want to keep those eyes safe and healthy from diabetic eye disease. Okay, so I'll be coming on throughout the month to talk to you more about diabetes and how it impacts the eye. And so if you're watching this live, please hashtag live. And if you're watching this replay, go ahead and write hashtag replay. If you know anyone who have diabetes and who would benefit from this information, please share this video with them. And if yourself, you have diabetes and you happen to live in our area and you're looking for an excellent doctor, we are more than happy to see you. Just go to our website, www.lacenterforeyes.com, or reach out to me on Facebook or Instagram, and we'd be happy to make an appointment for you. Okay, that's it, and I'll see you next time. Bye.